president's history when it comes to children includes jailing migrant children. Here's what he said about returning children to school in the fall just a few moments ago.
We hope that most schools are going to be open. We don't want people to make political statements or do it for political reasons. I think it's going to be good for them politically, so they keep the schools closed. No way. So we're very much going to put pressure on governors and everybody else to open the schools, to get them open. And it's very important. It's very important for our country. It's very important for the well-being of the student and the parents. So we're going to be putting a lot of pressure on open your schools in the fall.
Dr. Wen, what role is there for politics in this, what could be life or death decision for families and teachers about reopening school?
There is no role for politics here. I mean, just to what Donald Trump just said, I don't think anyone wants schools to be closed come the fall. No working parent wants that. We want schools to reopen, but we also want to do so safely. And we've seen all along that you can't just pick a random date and say, well, everything is going to be reopened at that point. Actually, you have to do the work for us to get there. And the most important thing that all of us can do is to suppress the level of virus in our community. Nobody wants schools to be opened at a time when ICUs are bursting past capacity, when there are patients who can't get in to seek care, when the virus is surging all throughout communities in the country. The most important thing we can do is to think, if our priority is for schools to be reopened in the fall, what are the steps that we have to take right now? That's suppressing the virus. Maybe we need to be restricting things like bars and other indoor gatherings over the summer. We also have to very rapidly ramp up testing and contact tracing and these other things that are also going to be important for schools to reopen. And I think we need to take into consideration, too, the challenges for staff and other workers who have chronic conditions, because we also don't want to endanger them either.
I want to go through some of the other headlines, and I want your thoughts on Anthony Fauci's interview yesterday. Let me start with you. You raised testing. This is from the New York Times today. In recent weeks, as cases have surged in many states, the demand for testing has soared, surpassing capacity and creating a new testing crisis. In many cities, officials said a combination of factors was now fueling the problem: a shortage of certain supplies, backlogs at laboratories that process the tests, and skyrocketing growth of the virus as cases climb in almost 40 states. How are we on month 5 still not at capacity for testing every American that needs a test? Donald Trump promised at the CDC, I think, in early March, that anyone who wants a test could have one. I'm not sure there's a bigger whopper of a lie that he's told since this started.
Nicole, this is it. We've been talking about testing for many months now, and we've talked about the problems all along, that there is a supply chain issue. You can't just have enough swabs if you don't have enough reagents. You can't have reagents and then run out of the PPE that healthcare workers need in order to supply and to deliver these tests. I mean, we need to secure a much larger, widespread testing, and not only testing that's for everyone who needs it, but also rapid testing, because having someone wait 5, 7, or even 10 days for test results to come back just is not going to be effective in reining in the infection. And I think it needs to be said that we now know what it takes in order to control COVID-19. Other countries have done it. Germany, South Korea, New Zealand, so many other countries have successfully reined in COVID-19. We know what we need. That begins with testing. And it's really a travesty that we in this country haven't figured it out, even though it's the same virus. It's not as if these other countries have a vaccine or treatment that we don't. We just need to get to work and have a national strategy led by this administration.
Dr. Wen, the president has not made any moves toward having one. Can we beat it without him? And what do you make of Dr. Fauci's comments yesterday that we are knee deep in the first wave?
Well, Dr. Fauci is right that we never suppressed the level of infections the way that other countries have. And so we are still in the first wave of this infection, except that we're seeing rapid surges, escalating surges all throughout the country. I think that governors and mayors and other officials are trying their best. Certainly my public health colleagues around the country are doing their best with the limited tools that they have. But this is something that when we look at other countries, the one thing they have in common, the countries that have successfully fought this, is that they've had a national coordinated strategy. And I just fear that we'll have many more preventable infections and deaths unless we have one here.
Hey there, I'm Chris Hayes from MSNBC. Thanks for watching MSNBC on YouTube. If you want to keep up to date with the videos we're putting out, you can click subscribe just below me or click over on this list to see lots of other great videos.